Organizations dedicated to caring for individuals are better equipped to tackle the challenges of today and the future. The concept of prioritizing emotional health doubles as a strategic investment in organizational well-being, an essential cornerstone in this field. Just to clarify, I am Marta Pérez de Vargas Bonilla, the Area Head of Occupational Psychology and Ergonomics at the Renfe Group. At Renfe, concern for emotional well-being has been a long-standing priority. However, the labor and societal transformations triggered by the COVID-19 pandemic compelled us to elevate our efforts beyond the existing measures. This decision was driven by a notable rise in stress incidents, mental exhaustion, and difficulties in balancing personal and professional responsibilities. That made us that we should take some type of action in that sense. This situation manifested itself especially among operational personnel who had direct contact with the public, where there was also a tendency to ask for support, especially in psychological matters. This made us evolve, although we already had a PAI, an employee support program, but evolving from 1.1, a much more technological and human strategy for us. Iconea has given us that moment, that turning point. The aim was to advance from merely managing issues as they arose to adopting a proactive and preventive framework, precisely the advantage this tool offers us. Well, look, emotional health is not just a trend, but a necessity, okay? And with the solution he proposed to us. So with EA, we combined artificial intelligence, we combined confidentiality and accessibility for the user. This tool allows us to detect risk patterns that could possibly trigger a problem, providing our employees with tools and strategies. We saw that this could be a solution to improve their well-being. Acting in a way from self-care, as we would say, a part reactive to the sessions that can later also be used by workers with a professional in charge. And to give you some information, for example, 70% of active users have told us an improvement in their emotional situation since they connected with the tool. As an objective, mainly, we also wanted to strengthen the strategy within that of the prevention of occupational risks, especially in terms of psychosocial risks within the organization. The platform allowed us to address all these types of situations from a more personalized perspective and directed confidentially also to the worker. Take Renfe, for example, where safety, customer service, and production efficiency are foundational pillars that are fundamental to its operation. The importance of prioritizing our employees' emotional well-being is undeniable, as this not only has a direct impact on productivity, but fosters a harmonious working environment. But also in retaining talent within our organization. In addition, the opportunity to provide strategies to our workers in this matter also gave us an opportunity for accessibility to the client, showing an improvement in care in a much more sensitive and empathetic way. All this reinforces our culture of considering the organization within a healthy environment, resilient and inclusive. The reality is that the implementation process went smoothly, with the Psyconea team playing a key role in simplifying it for us. We began with 3 essential phases: gaining internal knowledge of the company, understanding our procedures, and focusing on our working methods, particularly on preventing psychosocial problems. Additionally, we worked on fostering internal communication. With the help of our communication team, we ensured accessibility for workers who are the target of the service, while fostering global integration. This was achieved through the support of the workers' legal representatives and the health and safety committees within the company. I would also highlight the team's close involvement, results-driven approach, and seamless cooperation. To be able to launch this entire project in the company, The truth is that we were surprised by the speed with which we began to have the participation of workers. We immediately began to have a high level of users on the platform, and we began to have quite a few participation records within it. But it is true that as a challenge, we need to collaborate, or we needed at that time to collaborate or participate in awareness campaigns with workers through internal communication. With our workers, perhaps breaking certain taboos in the mental health environment was a priority for us for the platform. Over time, it has given us certain guarantees regarding confidentiality that have made the worker actively participate within the platform. The key was to convey that taking care of oneself was not a sign of weakness, but a sign of responsibility and maturity. Well, starting from the second month, we began to notice certain improvements, especially in traits related to stress and emotional fatigue, traits that were also essential for a satisfactory work environment and climate, especially in the mental health environment. The interesting thing about all this, also what the workers transmitted to us, is that they felt accompanied in their daily lives with the strategies learned thanks to the tool. This insight helped us deeply value how the tool fosters empathy for daily activities across both professional and personal realms. It's vital to recognize that the tool's utility extends beyond merely enhancing the work environment, where we may not always be present, and into enriching personal spaces as well. Ultimately, we strive to cultivate a truly holistic perspective that unifies these aspects. A profound sense of emotional assurance for employees as they navigate their daily routines, whether within our facilities or as part of our organization. This has indeed marked a pivotal moment for the organization and the Occupational Risk Prevention Department, particularly regarding psychosocial risks, as we've observed notable improvements in areas like stress, fatigue, and overall well-being. Among the workers and users assigned to the platform, this has also allowed us to manage data from a confidential and anonymized point of view, the management of statistical data that gives us a more preventive or more specific detailed guidance to the specific problem that we may find in certain work environments. Since we began using the platform, an impressive 17% of users have reported noticeable improvements in anxiety and stress levels. This is a significant milestone that has positively influenced our overall workplace environment, particularly in fostering emotional well-being among our workers. Additionally, 18% of users have engaged with the platform's reactive or assistance features when needed, highlighting its supportive role. Meanwhile, 82% of users have benefited from the platform's self-care tools, including videos and interactive demonstrations. These resources effectively empower workers with actionable strategies to enhance both their professional and personal spheres. This high level of engagement underscores the platform's preventive approach, reflecting its core mission of fostering well-being before the need for intervention arises. We aim to provide this comprehensive perspective through the inclusion of a PAE, reinforcing our commitment to the overall support and well-being of our workforce. With this category of solutions, the organization fosters permission to listen, ensures greater accessibility, and demonstrates genuine empathy toward workers regarding mental health matters. Indeed, I would wholeheartedly and unequivocally recommend it, as it is supported by data-driven evidence that facilitates extrapolation, ultimately enabling a more comprehensive and objective assessment criterion. Both qualitatively and quantitatively, this initiative enhances health and emotional well-being. The notion of prioritizing emotional health doubles as a strategic investment in the broader scope of organizational health, serving as an essential cornerstone, particularly when implemented as a robust component of occupational risk prevention strategies. The primary and essential takeaway is that prioritizing emotional health should be a cornerstone strategy in managing people, one substantiated by data that fosters sustainability and generates insights applicable across various departments in a deeply committed and enduring manner within the company. Evidence grounded in data enables us to design strategies that are not just applicable in the here and now, but also span into the future, ensuring a pragmatic, not just perfunctory approach to emotional health. Using this platform allows us to proactively address issues with an analytical reliance on data that adds substantial value. By offering tangible solutions for employees, this system empowers workers with practical strategies for self-care in their daily lives. What stands out most is the cutting-edge data-driven platform, which provides objective, reliable solutions, combining both qualitative and quantitative analyses to support a far more dependable preventive framework for integration within the organization. Organizations that care for people are best prepared to face the challenges of the present and tomorrow.